Hello there. It's my honor, actually. Um, uh, you know, I think all among the panelists, I'm the least experienced on these newest TESS lab. So is this? I have to say this is Thai early experience, and I so honored to conducted the very first studies, clinical study in Thailand. And this study is actually has not been supported by company, but all the product that has been used in this study it's provided from Eden Colors Thailand, so which is the local distributor of Thailand. My background is a dermatologist, dermatologic surgeon, which I feel comfortable working on anything non-surgical, facial lifting. So lift is again a newest area in my hands. I use laser, I use light-based device, RF, high intensity focused ultrasound, and sometimes I use injectables for facial lifting. But when you're talking about lifting, everyone when coming, all your patients when coming to see you, they just say like lifting, I want these. And in my hands and all my tools as a dermatologist, I think there is no much of the tools that can provide the mechanical lifting like what my patient really expect and look for. When we're talking about PDO thread lift has been around for some quite of time. I think it's more than 10 years in Thailand. What we all know is the PDO or polydioxanone thread is minimally invasive technique for facial rejuvenation. It's safe, and there is a publication from Korea. There is a different type of thread. I think Dr. Humayun, my dear friend from Pakistan, already mentioned all the cone, the barb, the cork. So I'm not go over all that technology, but this is what you might know. Some of the thread has been the needle insertion. Some of the thread has cannula, like what we are talking now is TESS lip. So I think as dermatologists who feel more familiar with using injectables or fillers, we familiar with using cannula, introducing fillers. So I think it's the same feeling. So that is why we feel more comfortable working with thread with cannula because it's already in our hands and we all know. 10 years ago, the technique is not like today. So they introduced a lot of thread, floating non-barb thread. So which there is a lot of debates on using that kind of thread instead of using it for barb or cork that can provide mechanical lifting. And early age, when thread has been introduced to Thailand, they claim to use for full face or maybe sometime in the body, but usually they need plenty, I think might be hundreds of thread in one area. And I think that might not be suitable for some patients who cannot tolerate the lengthy operation. What we found from PDO thread lifting is we can find instant lifting through mechanical effect. But what we expect, like Dr. Humayun, my dear friend, says, we want cellular renewal through collagen stimulation. So, even at a shorter period of time, you need mechanical lifting to show your patient something that is changed on their face. But what you're expecting is the cellular renewal from the collagen stimulation and neovascularization to improve texture, line, and even elasticity. And thread usually depend on the type. It can be well absorbed within 6 months, or some of the thread can be absorbed faster, but averagely 6 to 8 months. But if you want to talk about collagen stimulation, we all dermatologists know what is the fact about human collagen. You have to know two types of actually more than that, but there is a fibrillar collagen and reticular collagen. So it's type 1, 2, 3 collagen. And when we age, collagen content reduced by 1% per year, especially after 30 years old. So for me, I'm now almost 50, so which means my collagen has already been gone, degraded for almost 20% if I'm not do anything. So that is so scary. So that is why we trying to treat our patient, in terms of increasing collagen or collagen stimulation is not only for contouring, but also for texture and quality of the skin. However, another dear friend of mine, Dr. Alexander Turkovich from Ukraine. So he is also conducting a very, very nice study, seeing and showing what thread can be done and how it can stimulate collagen in the body, or actually in the dermis. So he did a very nice laid out studies, putting the thread on, especially PDO. He did biopsy and he shows, I think pictures speak louder than words. And you can see that there is a collagen formation around the thread, so designing wise is not only the important by giving the mechanical lifting direction or vector, but you have to lay it out nicely to provide the area that you want collagen stimulation as well, because this is the long-term effect that you need from putting the threads in. However, there is also cons of using that. The collagen that is formed, it's formed in different period of time, and biodegradation substance is really important. So choosing the thread substance is as more important as the vector and the design as well. But sometimes if you are not doing it well, collagen production can be unevenly, which you might not need it. Again, another ethical consideration that we need is in Thailand, 5 years ago, PDO thread has been approved in Thai FDA only for suturing, not the lifting effects, because there is no clinical and efficacy that has been proved or duration. So that is why if you want to do it, you had to have the evidence-based study support. That is how I'm coming into this business, just to prove the efficacy. There is also a studies way back to show that the aesthetic improvement of non-thread lifting rejuvenation, it's very short, and it can be sometimes lunchtime procedures, you can do it short, but there is also a cons of having less proven data to make it effectively. So that is why the momentum shift from using multiple hanging thread to something that really can create the mechanical lifting, because we want something that lasts longer. And when you're talking about mechanical lifting, we all females do that. When we age, we're trying to pull our hair back. So like me, I'm trying to do it so because, you're hoping the mechanical lift to lift your lower part of the face. But however, there is also a term called traction alopecia if you pull your hair too much. So, you can start having alopecia at the upper forehead here, so which might not look so good on you. Again, $1 million question is still there. Like, what is the ideal thread for facelifting? As a doctor, how would you choose the right product? So for me, I think I need something that can provide strong mechanical lifting, even with short-term improvement for mechanical lifting. So my patients see something that is worth coming to see me at the clinic. Secondly, I want something that can stimulate collagen effectively and evenly. So, during the degradation process, it should be affordable and need less puncture site, because the more puncture sites, the more infection that can be. And last but not least, as an ethical doctor, I think I want something that approved by Thai FDA for facelifting, not for suturing. And so far there is 4 products in Thailand that has been approved by Thai FDA for facelifting. The first one is the Definus. The second one is the Mint Lift, Silhouette Soft, and lastly is TESS Lip Soft. Is the least on the market. So this is all the product that has been approved now in Thailand that I can use it with my comfort zone. Again, this is all. So when I bought the product, not much of the doctor asking for the document for the FDA, the real one. I do. So I got all of these products that has been approved. So sorry that this is in Thai. For Thai attendees, you might know what I mean. And next part of my talk is my personal experience with the thread lifting. Actually, I had the first hands on the Definis first. I even conducted the clinical study with my dear friend again, Dr. Salvatore Fundaro from Italy, because the Definis is the Italian brand. And we published long-term results of the study by using Definis in Thai people. So what we did is we used the thread just one each on the side. And this is what I found. And the reason why I mention this is because, if you're choosing a good thread lift, and hopefully thread lift soft will provide the same effect. You can see that it provides immediately lifting, and then 1 week looks so good, 1 month. When the lift started to degrade it, it fall off a bit. But again, after 6 months, you can start seeing the tightening. That was not from mechanical lifting anymore. It's actually from the collagen stimulation, which we want from all the thread lift. And I think from the 90-degree, from the profile, you can see that, at 1 week, it looks so good. But at a month after degradation, it's starting to sink in a bit. But look at 6 months, the tightening is there from collagen stimulation. And I think this is what we want. Again, you can improve submental area. You can not only the jawline, but again, on the submental area. But you have to ask the patient, you can't really tightening it immediately from deafness, but you can see collagen stimulation over the period of time. And now when TESS Lift get into town, so, I'm the evidence-based girl. So I can't wait to just like getting the hands-on. And, luckily after the pandemic start to get improved, like better in Thailand, we did conducted the study along with the workshop for my fellows. So we have the workshop, which what I found is this is the thread that is very easy, as I mentioned at the beginning, that, for those of the dermatologists who work with cannula for fillers, you will like this way, and how to find and guide it the good direction and the plane. So, averagely, my fellows, they need only maybe 2 cadaver practicing and 1 or 2 hand-on cases till they find the right plane to do so. So I can consider this is a very easy thread to be trained. And again, let me emphasize on this, that I don't get any paid from the company to conducting the study, but, out of my interest, I want to try it on my hands. And I get a free product for using in my patients. And you might see this is the match. Again, I'm not go over since all the previous speaker has been talking about how it's look like and what is the good and pros of all these TESS Lift Soft products. But I get to try on my Thai patient, and we recruit 25 subjects. And again, we record the GA score between mild to moderate score. And this is all the workshop and also the clinical study that has been done. This is all my fellows and me helping each other to treat the patients. And, there is one publication before me from the Korean doctor. So they did mid-face lifting. And I would like to emphasize this because the design for mid-face and lower face lifting may be different. Even though you use the same amount of thread on one side of the face, if you want to lift the mid-face, you may need the vector to go a bit higher and, up north. But if you want to go for the jawline and lower face, you may need a vector that is going more perpendicular, and you might need something around the neck and under it here. In some of the patients, I even get extra thread for submental if I really want it to, get the lifting. I will show the immediate result afterwards. But I think the important thing is the key of the design is depend on the facial shape of the patient. And, and luckily, Asian patient has a more like full face, like volumized and fatty face. So it will be a little bit more difficult when comparing to Western patients who always get a very nice contour from the thread lift. We did 2D photograph and also 3D photograph by using the Vectra. So we calculate the improvement of the volume on the jawline and submental area. And sometimes we will measure on the nasolabial fold as well. Very early results. This is just like immediate because we just finished conducting everything last week. And this is very early. And you can see this is from the front side, but look at the reshaping of the jawline. This is the immediately. Again, this is all mechanical lifting. There is no collagen stimulation yet, just trauma and edema. But, at least the patient feel happy to see something. Again, this is on the other side, here and there. Another patient, so you can see not only in younger patients, so this lady is almost 50, so she is 48, 9 something, and you can still see in her facial shape that is changed. Sometimes you can't really get rid of submental area like, immediately, but I'm expecting to see something in 3 months or afterwards. Another patient, and you can see there might be like, a dimpling, and this can be resolved within 2 weeks. But you can see the contouring very nicely. This is the other patient who I did extra thread underneath her submental just to even out and then, diminish the submental fat around here. Side effect, definitely, since I already mentioned I'm not the expert here, I'm newest one in town. But so far, this is the side effect that we can see, like irregularity, which resolve, like getting better in a week or two. um, Again, you can see dimple if you are not getting in a good plane, bruise, and sometimes when you go through on the very very hollow temporal area or very thin skin, you can see like some of the visible lump of the thread, because there is, it's there. Luckily, I did not see any Tyndall effect of the thread yet. Again, in for this patient, she looked very nice from the front, but look at her. She had a lot of erythema and bruise, like from trauma during the insertion. But it's all gone within 2 days. Again, dimpling. This is the worst case of dimpling, but again, luckily, after a week, it's all gone as well. Long-term result, longer term result is to be continued. So now I'm keeping my finger crossed to see what's going on after everything is fine. I'm looking forward to see collagen stimulation if it's ever. And thank you very much.